When we hear the word psychosis, our minds often jump straight to these really frightening stereotypes from movies, right? But what if we looked at it differently? What if we saw it not as some scary, defining illness, but as a human experience, something that can be understood, managed, and even navigated? Well, today, that's exactly what we're going to do. We're demystifying psychosis, all the way from diagnosis to hope.
So what is psychosis, Riley? At its core, it's basically a collection of symptoms. Think of it like a big umbrella term. It can include things like hallucinations, seeing or hearing things that other people don't, or delusions, which are these really strong beliefs that don't quite line up with reality. It can also mess with how a person thinks or speaks. It's a broad term, for sure, but it all points to a kind of disconnect from our shared sense of reality.
And you might be surprised at how common this actually is. The lifetime prevalence of psychotic disorders is about 3%. Now, that might not sound like a lot, but think about it. That's 3 out of every 100 people. So it's a much bigger part of the human experience than most of us realize, which makes understanding it that much more important.
All right, so let's push past the clinical definitions and all those media portrayals. What's it actually like to experience psychosis?
Well, for the person going through it, these experiences can feel incredibly real. And as you could imagine, they can be super confusing and often really, really frightening. And that distress, it doesn't just stay with them. It ripples outward, affecting family and friends who are often just struggling to understand what's happening and figure out how they can possibly help. It's just a deeply challenging time for everyone involved.
So when someone comes in with these symptoms, the first step is figuring out what's going on. But this is where it gets tricky. It's almost never a simple case of just checking off a few boxes. It's way more like being a detective, carefully gathering clues to solve a really complex puzzle.
Okay, so the first big fork in the road for any clinician is this. Is this a primary psychosis, meaning it's coming from a psychiatric disorder like schizophrenia, or is it secondary, meaning it's being caused by some other underlying medical issue? And the clues are different. Primary psychosis, for instance, often involves hearing voices, while a secondary psychosis might be more likely to involve seeing things that aren't there.
And the list of potential medical causes is just staggering. Seriously. We're talking about everything from thyroid problems, to brain tumors, to infections, to something as simple as a vitamin B12 deficiency. This is exactly why a super thorough medical workup is absolutely critical. You have to rule all of this stuff out before you can even think about a psychiatric diagnosis.
And then, the puzzle gets another layer of complexity: culture. This quote is so important. A belief is only really considered a delusion if it's not a part of that person's culture or community. For example, certain religious or spiritual experiences could easily be misinterpreted as psychosis if you don't have that cultural context. It's a huge reminder that diagnosis needs sensitivity and understanding, not just a clinical checklist.
So, okay, let's say the detective work is done. The clinicians have pieced together the puzzle, and there's a diagnosis. The next massive question is, now what? How do we move from that diagnosis to actually helping? How do we reduce the very real suffering that these symptoms can cause?
Well, this brings us to a really game-changing approach. It's an evidence-based therapy called cognitive behavioral therapy for psychosis, or CBTp for short. And this isn't just about managing symptoms with medication. This is a talk therapy that's designed to fundamentally change a person's relationship with their own experiences.
And here's the key idea, the part that might be a little surprising. The goal of CBTP isn't necessarily to make the voices or the unusual beliefs just vanish. The main goal is to reduce the distress and the disability they cause. It's a huge shift in focus from trying to eliminate the symptoms to empowering the person. It's all about helping someone live a full, meaningful life, even if those experiences are still around.
So what does this look like in the therapy room? Well, first off, it's deeply collaborative. The therapist isn't some all-knowing expert handing down wisdom. Nope, they're a partner. They work with the individual as an equal because they recognize that the patient is the only expert on their own inner world. They use this gentle, curious approach. The source calls it a Columbo-style, lots of just one more thing type questions, to really understand how a person got to their conclusions. It's all about normalizing the experience, not judging.
Okay, so how does this actually work? How do you rewire these beliefs? Well, CBTP helps people do for themselves what that detective does with a case. You carefully and gently examine the evidence for your own thoughts. It's this amazing process of guided self-discovery.
And the foundational tool for this is the ABC model. It looks simple, but it is incredibly powerful. See, most of us think that an activating event, something that happens, directly causes our emotional consequence, how we feel. But CBT shows us there's a critical step in the middle. Our beliefs are how we interpret that event. It's not what happens to us, it's what we tell ourselves about what happens that really drives our feelings. Let's use this example of Anna to make it super clear. The activating event, A, is simple. Someone gives her a compliment. But her automatic thought, her belief, B, is they must want something from me. And that leads directly to the consequence, C, of feeling worried and wanting to get away. Now, why does she think that? Because it's all being filtered through this deeper core belief that people cannot be trusted. CBT helps bring all these hidden links to the surface. And to put this into practice, therapists teach these really simple, memorable techniques like the 3 C's. First, you learn to catch that automatic thought as it happens. Then you check it, play detective. Is it really 100% true? What's the evidence? And finally, you work to change it to a more balanced, more helpful thought. Catch it, check it, change it. So, okay, why does all of this matter so much? Because approaches like CBTP are part of a massive, monumental shift in how we view and treat psychosis. It's a shift away from stigma and fear and a move towards real empowerment and genuine hope.
I mean, let's just take hearing voices, right? That classic symptom. These statistics are absolutely fascinating, and they do so much to normalize the whole experience. Up to 5% of the entire population hears voices. And get this, over half, 53%, say they feel little to no distress from them. That completely shatters the stereotype that hearing voices is automatically this terrifying, awful thing.
And that leads us to this incredibly profound insight, which is really the beating heart of CBTP. It's not the voices themselves that cause the distress. It's the beliefs a person holds about the voices. Think about it. If you believe a voice is a demon that can hurt you, you're going to be terrified. But if you come to believe it's just a strange sensory experience, kind of like your brain's version of tinnitus, the fear just plummets. And this is not just a theory. Look at these two amazing people. On the left, you have Lynn Sachs, a brilliant and respected law professor. On the right, the one and only Sir Anthony Hopkins, an Oscar-winning actor. Both are public figures who have openly shared that they live with psychotic symptoms. They are such powerful, living proof that a diagnosis does not define you, and it certainly doesn't stop you from living a rich, successful, incredible life. And really, that's the promise of this whole approach. It empowers people. It gives them the tools to become the experts on their own minds, to turn down the volume on their distress, and to get back into the driver's seat of their own lives. It's a message of profound agency and, honestly, of hope. Which leaves us with one final thought to mull over. What if we shifted our whole idea of what recovery even means? What if it's less about chasing a cure that eliminates every single symptom and more about the deeply personal, powerful process of understanding your experiences and reclaiming your own story?